back in September 2012 or July 2012, there was legislation that went in about concussions and making student athletes and parents aware of what they are and how we handle them. And so this is part of that requirement. First off, if you picked up the handouts in the lobby there, the first page there just shows the team that Faith Regional has to take care of your student athlete. Dr. Henke, who has Pierce Family Medicine downtown, is a critical part of our sports medicine team for quick and efficient and quality care for student athletes here in Pierce. Secondly is Russ Balmer. He is a physical therapist, does a great job with those that happen to get injured or have surgeries. And he comes to the school, which is really convenient for you and the student athlete. They can just walk down the hall and get some physical therapy if needed. And, that just helps speed up and increase the quality of care that your student athlete can receive by having all of three of us on the same page. The collaborative approach to medicine is really vital to providing the best care we can for your student athlete. So with the Concussion Awareness Act, there's 4 pieces to that. The first is education. In that form, there's some websites there with some short, simple videos. If you'd like to go on there and look at those, they're really not very painful at all. If you want more information about a concussion, or say your student athlete has a concussion in their season, down the road here, and you want to know more about what a concussion is or what I should be watching for or those kinds of things. And if I didn't explain it to you well enough, that's a great resource to go and check that out. So obviously with the risk of sustaining a head injury, it can happen in any sport, but if not treated properly, a head injury can be fatal. And so we don't want to see anything like that happen. And so, early recognition of that is very important. And so the actions to take, should you suspect that your son or daughter has sustained a concussion, is to notify someone, whether that's me, whether that's the coach, whether that's Mrs. Prawl in the front office. Let someone know, hey, I think we've got this going on. We'd like to have Adam take a look at it, or, your physician. You can take them directly to your physician. What you're watching for, obviously, are the classic signs of your headaches, confusion, irritability, nausea, vision problems. Obviously that's not a conclusive list, but those are the main ones that you will normally see. So if you see anything like that, just speak up. What my action is when I suspect a concussion, any athlete suspected of having a concussion in a game or practice is removed from play and is not allowed to return to play until they've been properly evaluated by a healthcare professional. And what that means is anyone who is licensed in the state of Nebraska and also has some experience with head injuries. So you don't want to go to your normal chiropractor to have them assess the head injury. I think you would know that, but you just can't go to anybody and get them signed off. It's got to be a licensed healthcare professional and someone that has some experience. So that's probably your family physician, PA, nurse practitioner, athletic trainer. That's not everyone, but that's the most common people that would deal with those kinds of injuries. And then once they've been assessed, then we need to have a written clearance, which is just a form that explains how we return them to activity, and it's a gradual progression each day over the course of 5 days to increase their activity slowly, monitoring their symptoms, and then signed by, if it's me conducting the return to play, then it's signed by myself and by you and by the student athlete, just so that we're all on the same page with that. The next component of that is the return to learn. So someone is suspected of a head injury. If it happens here, I'll notify Mr. Bramer, and he'll notify the concussion team that we have in place here at school, which allows for some modifications in the classroom. Because of the nature of head injuries, we need physical rest. That's the most commonly thought about, but we also need cognitive rest. And what that means is, just limited brain activity. So that might mean frequent breaks from class, or being allowed to leave class 2 minutes early so they're not in the noisy hallway as they go to their next class. Or maybe it means being in the library to get their homework done, and limiting computer time and TV time and those kinds of things. And then once they're cleared for return to learn, no modifications in the classroom, then they'll see me and we'll do the return to play, which is that gradual stepwise progression that I talked about, and then they'll be signed off and cleared for activity. So like Mr. Sindelar said, there's a small sheet in the lobby. Most of you, I think I saw most of you sign this. If you haven't, this is why you're sitting here, so sign this so you get credit for that. And we'll need to have that. Then the large sheet is for Fayette Regional. It's a front and a back, and it's a release of information so that I can speak with appropriate school personnel, namely the coach, about your son or daughter's condition and their medical condition. And then the other side is just a consent for treatment, so that since I'm here and they get hurt here, then it's okay for me to assess them and be in communication with you about how to handle the injury and what we should do, moving forward. So, again, as the athletic trainer here, I'm responding and evaluating and caring for injuries, taping, first aid, rehab, those kinds of things. We bring in Russ Baumert as needed for physical therapy. But part of that information you have there also is we talk about things sometimes in the training room or in the classroom setting about thinking about what they're doing off the field, whether that's diet, sleep, those kinds of things is going to affect them on the field or in the classroom. And so part of that is if you have had a student athlete in high school, we do the protein recovery. And that's not for trying to bulk everybody up, but kind of gets misconstrued that way sometimes. That's simply for a recovery drink. And you can see on one of those pages, immediate intake of protein following a strenuous activity that stresses many systems of the body increases the recovery exponentially as to not doing anything. And so, we'll have that available again this year, hopefully with chocolate milk and protein in the coach's office, and that's available to any student athlete that wants to do it. And so, if you have questions about that, if you have questions about anything that I've talked about or throughout the year, please don't hesitate to just reach out and get in touch with me, either through the school or, your son or daughter probably has my cell phone number, and you can get in touch with me, that's no problem at all. A quick text, or if you want to call, it doesn't matter. I just want to help the student athlete be as healthy and as successful as they can be in their particular arena. And that's why I'm here. That's why Russ comes here. That's why Dr. Hankey does such a great job with. I can pick up the phone and say, I just had a kid. I think he needs an X-ray. He says, send him down. We don't have to wait for an appointment and those kinds of things. And so it's really been a great team. And so if you have any questions at all, I'll be out in the lobby after this. You can see me there. You can see me there to get your forms taken care of, so that we don't have to worry about taking them home or losing them or chasing you down later to get those so that your son or daughter can participate.